Right. Good afternoon, and thank you, Raj. And it's an absolute pleasure to be having the opportunity to speak to an audience of aspiring healthcare professionals who want to work or maybe are on the journey of working within our National Health Service. And I think the first thing I'd like to say is that the NHS is a really special place to work in. It is a healthcare service that is rooted in values of providing care free at the point of access. That's not the norm in many other nations, including many other European nations, where there are no cost barriers. No one needs to be concerned about the ability to pay if they need help and assistance, treatment. And it's a fair health service based around the principles of treatment based on clinical need. And it doesn't matter who you are, whether you're what sector of society you come from, you will be treated according to your clinical condition within the National Health Service. And I think it's important to feel proud of working within such an environment, which the Commonwealth Fund have rated as being the most effective, cost-effective and equitable healthcare service in the world. I think that the recent COVID pandemic, and we're of course not through it yet, has also shown the incredible camaraderie and teamwork that we all feel part of working in a national health service. And so it's again a reflection of all those values that I described earlier, and the real commitment to do good and work with each other. And it's really brought the whole community, not just of healthcare professionals, but also of social care staff and those working in the community together. The NHS, of course, does, having said all of that, have its challenges, and the British Medical Association have been very clear that we need to spend more on our health service. We spend billions, tens of billions of pounds less in proportionate terms compared to France, Germany, and other nations. We're one of the lowest GDP, lowest proportion of GDP compared to other nations in terms of healthcare spend. We also have far fewer numbers of healthcare professionals per capita, and which is good that we're having this conference today, because we of course want as many people to work in our health service. Just to give an example, we're probably about tens of thousands fewer doctors per head compared to France, Germany. It's just something that, of course, needs to be corrected, and the BMA has been campaigning for. And we had about 10,000 medical vacancies before the pandemic. We also need a better infrastructure. We have about a third of the hospital beds compared to Germany. And so overall, this is an important part of, I think, our collective efforts as healthcare professionals to lobby and make sure that on the back of COVID, that the government, whoever the government is in the future, commits to a proper funded and resourced health service, at levels that really should be equivalent to the best of other Western nations. And that, I believe, would make all of our jobs much more rewarding, and our ability to care for patients so much more effective. I now want to just move on to the British Medical Association, and as you know, I'm chair of the British Medical Association Council. I'm also a GP, and because today is a event for a variety of healthcare professionals, want to make sure that it's made clear that doctors see themselves as part of an interdependent group of healthcare professionals that make up our NHS. We work in teams, whether we're in hospitals or whether we're in general practice. And so we do feel, and rightly so, that we are, one cog, and everyone's a cog in the wheel of the NHS. So if I look at my own GP practice, and I've been in my practice for 30 years, ever since I qualified as a GP. I've never looked back. It's a fantastic career. But when I look back at the last, 5 years, we've transformed as a practice in what was initially a practice with largely doctors and supported by a couple of practice nurses, to one now where we're working alongside a range of specialist nurses, enhanced nurses in the community who do our home visits alongside us. We have a range of pharmacists. Again, they have different skills. We're just about to employ a physiotherapist. We work alongside social prescribers and allied healthcare professionals. And so working as a doctor now is about working alongside a range of professionals. And I really hope that all of you who are not on a career path to becoming a doctor, who are part of this conference, feel very much that doctors are team players alongside yourself, because actually our work as doctors is absolutely dependent upon the work that everyone else in the health service does, because we all rely on each other. But I want to now just focus a little bit on the BMA itself and how we support the medical workforce. And I'd like to start by saying that the BMA supports, we are in fact the only medical body that represents, in professional union terms, the entirety of the medical profession, from medical students to doctors working in every single discipline, whether you're a GP, hospital doctor, junior, public health doctor, medical academic, medical manager. Every type of doctor public health doctor is covered by our association. But actually our work starts before anyone even enters medical school, because one of the key pieces of work we feel is important is to widen participation and to enable anyone who wants to be a doctor before at school to be able to apply and be successful, and not be disadvantaged through social class or any other barrier. So we have an aspiring doctors program that's led by our medical students committee to help even before you enter medical school. When someone is at medical school in the first year, the British Medical Association provides free membership without charge, and thereafter we continue to provide very low cost membership for our medical students. And that support is largely educational, because we know that medical students need to pass exams and learn. So we provide a learning package. We provide the British Medical Journal free of charge. We have a free online library, as well as a physical library that lends out books without charge, not even postage charges, to medical students. We provide careers advice so that medical students can be informed around the right choice when they complete their training to become a doctor. And when you become a doctor, the BMA is absolutely there for you, because one of our key roles is, of course, in negotiating pay terms and conditions. And I should also say that we provide advocacy. I want to go back to medical students, because we know that being a medical student can be very stressful. And so we can be advocates if there are issues around well-being. We provide well-being support. But we also provide support when there are disputes in medical school, for example, around exams, or maybe having a health condition that may create difficulties. So we're there to support. We have representative staff that can support any medical student in any medical school in the UK. So as I said, we then support young doctors, junior doctors who enter the profession, and we provide a contract checking service, because we want to make sure that doctors are protected with the right contract, with the right conditions and terms. If there are any difficulties as a doctor at any stage in your career, from a junior doctor right through to the most senior, later stages in your career, we provide services with regards to any problems you have with your employer, issues around any terms about your contract that aren't being adhered to. We'll be advocates for you. We'll support you in any concern that you might have, as a trade union should. And we provide that resource as part of your membership. So we're very much there from the beginning to the end of your career, there for you as the British Medical Association. I also want to say that we also are a professional organisation, and we have a large section of our membership that are involved in issues such as medical ethics, and we've provided guidance on issues such as withdrawing nutrition in some categories of patients who may be in a vegetative state, for example. So ethical issues like that. We've campaigned for an opt-out for organ donation to maximize the life chances of those that may need organs. We are very much players on the international stage. The British Medical Association is a member of the World Medical Association, and we've campaigned for universal health care coverage in other nations. We've campaigned to put an end to medical torture, for example. So we are campaigning on the international stage too. And we also do a lot of work on other scientific matters, and very recently, for example, a lot of work on the role of artificial intelligence in our NHS for the future. So if any of you are members of the BMA, you want to get involved in some of our professional work, you please do get involved. We certainly are doing a lot of that alongside our trade union representation. I want to just say a little bit about what the BMA is campaigning for in the NHS. And I started earlier by saying that we are campaigning for a proper resourced NHS, but we are also campaigning for the right environment and what we call a caring, supportive, collaborative NHS. It's a project that I initiated as chair of the BMA Council. And we're calling for a caring environment where the NHS can provide support to anyone who works within it, and make sure that when things go wrong, we don't have a blame culture, but a culture of learning, because we know, and we've learned over the last few years with some high profile incidents in the NHS, like the Dr. Garber case, that most problems that arise in the NHS are around systemic failures and the system not enabling healthcare professionals to do their work effectively. And we need to get to correcting those system factors, but you can only correct them if there is openness and a willingness to learn. And what we have at the moment is a culture that all too often actually ends up in fear and not being able to share concerns because of fear of blame. And that's not really helping patients, and it's not helping our NHS improve. So we've done a lot of work in creating a what we call a just culture. The other area that we believe is important in our health service is to have the right workforce, a workforce that can work together, and a workforce that plays upon each other's strengths and sufficient numbers. So we need a workforce strategy that achieves that. But we also need a collaborative strategy, because we have a National Health Service that has carved up the work that different healthcare professionals do, identified by organizations. And those organizations are driven by their own interests, especially in England, where you have a sort of market type of model of the way financial transactions occur and the way each provider is concerned with its own balance sheet. And we think that's the wrong way to run a National Health Service. We believe the right way to run a National Health Service is where these organizations are all interconnected and work collegiately. And instead of having perverse financial incentives or drivers that set us apart, we have drivers that actually help us work together without those barriers, either physical or managerial or financial barriers, because actually the resource of the NHS would stretch much further if we had systems that allowed, for example, hospital doctors and GPs in the community to actually work as a team, rather than having what we actually have at the moment are different budgets that result in different types of priorities. So I think it's worth mentioning, and it's important to mention, of course, the work of the BMA during the COVID pandemic, a pandemic that, of course, is not over yet by any stretch of the imagination. And the BMA's representative function is to look after doctors and make sure doctors are looked after themselves by the government. So right at the beginning, we campaigned very hard to make sure that doctors, and in fact we said the same for all healthcare professionals and care workers, should be provided with proper personal protective equipment. And we lobbied hard. I gave evidence to the Health Select Committee in March, and in particular in March we called for the supplies to be firstly available at a time when many doctors were going into work afraid that they wouldn't have basic equipment, from masks, visors through to gowns, and in fact these supplies were being rationed. But secondly, we didn't have Public Health England guidance that matched that of the World Health Organization, and we campaigned long and hard to get that corrected early in April. We also were very clear from the beginning and campaigned hard to have healthcare workers tested, because it was important for us to protect healthcare workers, and those that would be tested negative or were well enough to return to work should be able to return to work. And we put a lot of effort in campaigning, because in the early weeks, many of you will remember, healthcare workers were certainly not being tested, and certainly in the community, GPs were only tested at a rather late stage. When the COVID pandemic highlighted what was a really disturbing finding, that doctors were losing their lives, and that the BMA community were particularly affected, and in fact 95% of doctors who have died, over 40 now, have all come from a BMA background. Well, in early April, when the first 10 doctors had died, I called quite publicly on behalf of the British Medical Association for a government review, and I think we were the first pan-professional organisation to do that in such public terms, and I'm glad that that a review was conducted. But what we also called for as the BMA was to make sure that it wasn't just about a review into looking why we had this disturbing and alarming finding about the way our BMA community were affected, but more importantly, to do something about it in real time. And we've been campaigning since April for risk assessments and mitigations to be placed to protect those doctors and healthcare workers at highest risk of infection, or rather the consequences of infection, so that they could be redeployed or given additional protections, or be able to work remotely, etc. And remember, the NHS has a huge workload other than dealing with COVID. So redeployment and providing care perhaps more virtually was certainly possible, and without losing your workforce. It's not about taking doctors out of the workforce. It was about finding other ways that they could work in a safe manner. And after much lobbying, and we wrote lots of letters to NHS England and put a lot of representation on this in various fora, and both with the government but also with the opposition party, we now have got risk assessment tools. And then we found that although the tools were available, large numbers of doctors were not aware of their entitlement to risk assessment. And so I wrote to all doctors to remind them, all BMA members, to remind them of that entitlement, and we put a campaign to direct that. We've run surveys, what we call tracker surveys, throughout the pandemic, giving us real information about the experiences of doctors throughout, whether they've had PPE, right down to whether they've actually been risk assessed, and whether they've been aware of their provider providing them, or their employer providing them with those risk assessments. And we've used the results of those surveys very much to lobby for change, and that has made a difference in the evidence we've given to various select committees, to the National Audit Office, to Public Health England, and others. So we also want to, of course, recognise that doctors have worked not just hard, but the pandemic has taken a real toll. Doctors have worked in a way that would have been unimaginable, to work in a hospital with seriously ill people, with no visitors. The doctors have had to be the conduit of holding an iPad to communicate with relatives. Doctors have had to look after their own colleagues. Junior doctors I've met have had to look after their consultant colleagues who've sometimes fallen ill and been cared for in intensive care. It has been quite a testing, challenging, emotionally challenging time for doctors, and some have had the most disturbing experience of seeing some of their colleagues actually not survive in this pandemic. So we've, throughout the pandemic, increased our wellbeing services, so doctors can access a 24-hour helpline for any services that they need, and we continue to provide that. And we've also extended that to the family members of doctors, because we know that the pandemic has taken a toll on family members too.
And that's such an
We've increased.
It's such an important thing that the British Medical Association have done there, Dr. Nagpaul, as you've highlighted.
Thank you.
The immense support that the British Medical Association have offered. I was just wondering if you'd like to share a key message to our audience.
Sure. So I think that in conclusion, the messages I'd like to finish with are saying that the NHS is a really special and unique place to work in, and we should be proud of its values that are as important today as they were when it was founded. And I'd like all of you who are at this conference to look forward to a career working in the NHS. I've said we need the NHS to be properly resourced, and we need all of us to be looked after by the government so that we can do our best. I want to be clear that if any of you, and I would say this of course, are not a member of the BMA, as a medical student or as a doctor, please do consider being a member. We are here to support you, and you can, by being part of the BMA, make the BMA a better place, because we would value your contribution. I want to say that at today's conference that we are all part of an NHS family, so all of you who are attending, please let's just hold hands together and make sure that we work together and call for the NHS that we want and need from government. And I wish you a successful conference today. Thank you very much for giving me the opportunity to speak today. Thank you.